Good morning. I think we'll get started. My name is Eric Weller. I am the Healthcare System Preparedness Program Administrator here for the South Central region, which includes the 11 counties. We have 15 hospitals, and as you'll see here in the audience for the news media, these are many of our partners that we have in our healthcare preparedness program here in the region, and they're here to show our collaboration and as we move forward, and we are happy to see some of our elected officials as well here today. You'll see people afterwards, and if there's specific questions, we're going to have a few prepared statements this morning, and then we'll move into some questions. Today we are facing one of those disasters that we have been planning and preparing for many years here in Minnesota. It's in the form of H1N1 novel influenza, formerly known as the swine flu, which as of this hour has been confirmed in 12 states, and within the last hour, as I said, within Minnesota. Now there are 12 states and in excess of 110 positive confirmed cases of this influenza. The Healthcare System Preparedness Program, which is funded by the Health and Human Services Department through the Minnesota Department of Health, it's our mission to bring healthcare and related organizations together to enhance communication, efficiency, effectiveness when a crisis or disaster strikes. Our ability to respond to the needs of the patients in this region is greatly enhanced by all of us working together, and it's the people that you see here. In the event that the H1N1 novel influenza is confirmed in our area, I am extremely confident in our collective ability to treat those who are infected and respond to the health and other concerns of our residents. At this time, I'd like to introduce Dr. Brian Whited, who is the ISJ Medical Center Director, for a couple comments. Dr. Whited.
Thank you. I'll just make it very brief. I think the idea this morning is to bring you up to speed with what's happened in the state, but also to show you that we're putting all the resources together. There's lots of collaboration going on around how we're going to handle this if this does indeed turn into the full-blown pandemic event that it could be. I think the key comments I want to make is that I still think that being reasonable rules the day. This still is an influenza virus. It seems to be acting very much like our seasonal influenza virus. Doesn't appear at this point anyway to have the same severity that they might have been seeing in the first cases that were reported out of Mexico. So again, what we would like to do today is to make sure that we answer your questions, but also to let you see, as multiple healthcare providers all working together, we're here to meet your needs. Thank you.
At this time, I'd like to introduce Dr. Mark Mathias, the Medical Director of the Mankato Clinic.
Just a few comments about what we're trying to do from the outpatient and inpatient side. Obviously, preparedness, and this is why we have all of us are here together talking about it, but also we're trying to do things in a standard format. As you see, we have a couple forms over here, and this will be in all of our waiting areas now, and we're going to ask our patients, when they come in, if they think they might have been exposed or have symptoms consistent with influenza, that we're going to ask them now to place a mask on it for their protection and for other patients' protection until we know the full severity of this potential pandemic. It's very important for our patients to understand what some of those symptoms are, and I think that's been well outlined, but again, it's fevers, chills, sore throat, runny nose, cough. A lot of people are questioning, do I have those symptoms? A lot of it is a typical typical cold and upper respiratory symptoms that other people are having. But it's important, if you do think that you might have symptoms like that, to go ahead and call, make an appointment, talk about some of those symptoms, and then also let us know so we're a little bit prepared when you come in. And we're taking steps in all of our clinics so we can know that you're coming in, whether it's the emergency room, the urgent care, or into your family physician or primary care doctor's office, so we can prepare, and we're taking some steps to isolate, get you seen as quickly as possible, and expedite that treatment. Again, we're in the mode of preparedness at this point in time. The best analogy I heard this morning on TV was someone said it's like we're sandbagging, we're preparing. We have no idea what's ahead, how high the river might crest, but we want to be prepared, and that's exactly what we're doing right now.
Thank you. Now I'd like to introduce Nita Assen, Director of Public Health for Nicollet County.
Thank you. Good morning. Over the last 5 years, public health in all counties have been working with hospitals, clinics, emergency management, city and county governments in the region, and the Minnesota Department of Health. The result is that plans are in place to respond to an outbreak of infectious disease with a particular focus on pandemic flu. As part of the planning process, all counties have regularly held exercises that would improve their preparedness. In fact, Nicollet County and LeSueur County will be having an exercise next month. By meeting with our partners in the region on a regular basis, we have benefited greatly by sharing our best practices with each other. And helping us to prepare in this way, the public can be assured that we will all be working together to respond if we have an H1N1 outbreak in our region. Thank you.
And then I'd finally like to introduce Kelly Hayter, Director of Public Health for Blue Earth County.
Good morning. I just want to follow up with all of the comments and urge the public to use common sense regarding the novel H1N1 flu virus. It's not a time to panic, it's a time to be aware. If you feel sick, by all means, contact your healthcare provider as soon as possible. If you're sick, we want to urge everyone to stay that way, eat healthy, exercise, get appropriate rest, and again, hand washing is definitely one of the best ways to prevent the spread.
Thank you, Kelly. Before I open up to general questions for the panel here or other people, is there anybody in the audience from our other partners? We have one hospital here which serves as the Regional Resource Hospital and also one clinic, but there's others from our partners. Does anyone else want to add anything before we open it up for questions from the news media? None. Okay. So, with that, I'm going to open it up for questions, and if you know who you want to direct your question to, I would have them come up to the microphone here, and we can get started. Questions from the news media. Tim, go ahead.
How many samples of all the clinics here sent to the state?
You guys want to come up and address that?
Dr. White and I were just discussing that. We've been doing surveillance on our own. Mankato Clinic is actually a surveillance center, so we have to send all of our samples, whether they're positive or negative, up to the state. On Monday we did 4, Tuesday we did 8, yesterday we did 13. So we're just trying to get a handle on how many people are coming in with the symptoms consistent with that. I think they've been doing more than that at the Mayo Health System and at ISJ. So far all of ours have been negative, which is good, but even if it's positive, that's positive for influenza A, then it has to be subtyped by the state, and at occasions, like we just heard about from the Cold Spring case, it has to be sent to Atlanta. Did that answer the question, Tim? Okay.
Yeah, the only other comments I'd add is that we are following the guidelines that are out there by the Minnesota Department of Health. We're only testing those that at this time would meet the risk criteria. They have symptoms and potentially have been in one of the endemic areas from travel. We have not been doing surveilling all people that come in. We're really targeting our surveillance.
And there is a form that goes along with every sample up to the state that they've asked us to complete, which includes their travel history as well as their symptomatology.
And how many have you sent up, or ISJs?
You know, I don't have an exact number. We've done a lot of rapid testing. As you can imagine, there's a number of people in. The thing you got to remember, we still have a smattering of the seasonal influenza still around. The symptoms are still the same. And so there are those, and the usual upper respiratory viral type infections that's not influenza have similar symptoms. So in this state of heightened alertness, I mean, we probably are running more rapid tests than we normally would. Now, only if they're the high-risk individuals do they get moved on to be sampled at the state level, because what they found is that the H1N1 virus isn't being picked up with all of them are not being picked up by the rapid test. The rapid test could be negative, and so they do need to send those on if there's a suspicion that this is indeed a high-risk individual. But if they don't meet the criteria for that, we have not been sending them on to the state lab.
And yours open negative, as you know?
Right, I have no confirmation of anything other than what was in Cold Spring.
why, I mean, the reaction has been, very strong, and yet, as you indicate, the symptoms have, in most cases, been very mild. Can you just give us an idea, I mean, why that's the reaction?
I'll answer first. On my part, it'd be speculation only. I think there is been prediction for some time now that we are due for a pandemic flu. I mean, they've been saying that for the last decade. I think that this is the first time that I think that they've seen something that has the potential to be that. It has kind of all the makings, if you will, of the perfect storm. And so for that reason, I'm sure there's more surveillance. The other thing I think we all have to remember is that information flows so freely now. This is what's changed this from previous sorts of things. We are all up to date and aware of everything through the internet that we wouldn't have had. So it might seem like we're really, exponentially giving this a lot more emphasis than maybe in the past, but maybe it's because we're more aware of all the dialogue and discussions that are happening. So that would be my speculation.
And I think a history lesson is probably necessary too. I think a lot of us have heard the stories from Dr. Ostrom will tell. About 1918, it started exactly the same time frame. It was pretty mild, went away for several months, and then came back. And it can change and mutate, and I think that's the concern. And that's why everybody's saying that preparation is really the key here in case it may go away and this would be the end of the story. But we just don't know, and that's a hard thing predicting what the virus is going to do.
If it does the worst case scenario, what do you do? I mean, what's the plan?
They get paid a bit more than I do. We are confident in our plans that what we have been working on, I think Nita spoke directly to it, as well as the doctors did. We have really been planning and playing exercises. We've done some pandemic flu exercises. We've talked about surge capacity and looking at alternate care sites. We have plans in place for that, and so if it gets to that level, we've done those worst case scenario models. When we do disaster planning, we always look at what's the worst case scenario. We hope we never get there, but we do have some plans in place for that, and we have those, and that's what we would be looking to implement fairly frequently. The key is the partners that we have in here. I will tell you, and I'm a little biased, I think our region is very well prepared compared to other regions across the state, and it's because of all of the partners that have come together. You see your emergency managers, public health, all of these people coming together, and I'm not sure you see that across the country. In Minnesota, we do fairly well at that, but across the country, you don't have everybody at the table. Who would have thought we would have had this room full of our partners today for this news conference?
Anything else to add, Jeff?
No, just the teamwork, I think, is the key here. So,
What about the, go ahead.
you can go ahead.
What about doses of Tamiflu and how many do you have, or how do you, your ability to get more, and are people asking for that more often when they come in, whether they have flu or not?
Of course, you can imagine that patients are concerned, and so yeah, they might be asking for the medicine inappropriately. I think the key here is, the last I had heard is that at the state level we had 400,000 courses of the treatment of Tamiflu, which is the medication that has been as identified as the one that the virus is susceptible to. And then we have an additional 200,000 coming from the Federal Emergency Reserve stockpile, and they thought that would be here within a week. Now, as far as who's going to get the medication, I am very confident we're going to have very strict criteria about who gets the medicine. I think that I think we fully understand that there's not going to be enough medicine for everyone to get it for all symptoms. I think that we would quickly deplete our supply. But I think those high-risk individuals, those that are at most risk from complications from the flu, those are the ones that are going to get the medications, and there will be strict guidelines at which all providers will be asked to follow.
That was kind of my question. I guess I was just curious, kind of the mood of patients as they're coming in. Are you seeing a lot of extra concern
You know, I think we are. I think that, as you might expect, again, you have to remember, they're getting as much bombardment around this information as we are, and we're in the business, so to speak. And so it really probably does heighten their anxiety more than maybe it should be at this point. And so I think the key for all of us is to really remind them that that this is still influenza. This is still something we deal with every fall, and ask that people use all the right precautions and those sorts of things. So again, I think just having them common sense rules of the day, trying to encourage them to not get overly excited. But on the other hand, if they do have symptoms, we're asking that they call ahead. We certainly will be using precautions, wearing the mask. And it's always a little scary to be in the doctor's office for your well child visit and see 3 other people sitting there with a mask on. I mean, so we're going to have to manage all of that, but I still think that that is the right approach. We want to take precaution where precaution is necessary, but we don't want to, cause anxiety where it's not necessary.
Just a follow-up to my previous question about worst-case scenario, I mean, I understand you have a plan. I guess I was looking for more like, what do you do? Do people get quarantined? How do you, I mean, what sort of specific things happen? So people, know what to expect. Go ahead.
Well, I can certainly, let me start with just from a hospital standpoint. Certainly we do have rooms that we can isolate people in. They're called negative pressure rooms. And the idea being is that allows that the air handling is different than the standard room. So we have that kind of precaution. We also know that if the, we also know that if we start to get really several cases that are going to require hospitalization, and again, remember, so far, very few of these cases have required hospitalization. But if we get to that point, we will have the ability to isolate off a wing, and we'll turn in a wing to the wing of H1N1 patients if we need to. So we have lots of resources that we can certainly call upon if we really truly get to that worst case scenario. So, and I'll let you guys answer from your vantage.
Well, the only thing I was going to talk about is this is one of the reasons we have some of the drills that we've already been through. And the scenario would play out that a significant portion of our population is sick, including our workforces. What do we do if half of our staff can't make it in? Then what do we do, and how do we utilize all the resources in the region? And I think I'll let Eric finish the comment, but that's really the important part, is how do the clinics and the hospitals and the pre-hospital people, our special needs populations, our nursing homes, how does everybody then fit into that scenario? And that's why you plan, and that's why this is a good exercise for us in preparation of knowing, okay, let's hope it never gets there, but what if it does? So you start thinking about some options down the way.
And I agree. My only last comment on that is from, they've talked about inpatient care, isolation, and quarantine, but public health also has isolation and quarantine, home monitoring. There are plans in place for that as well. They've been worked on for the last few years, and I'm confident in that public health's ability for those plans. And we did have a regional phone conference yesterday with all of our partners, and we kind of had a to-do list to go through, and on the to-do list was isolation and quarantine. Look at your plans, see if they're in place. Do we need to work on things over the next couple days for any additional planning? And so that is going on specifically to that. And Nita, do you want to talk from the INQ from a county perspective?
Well, I was just going to let people know what patients are being told to do if they have a case of H1N1 and are sent home. They are being sent home in voluntary isolation. And then the people who are caregivers are asked to put on masks, gloves, sanitize surfaces, and that type of thing to reduce their risk. So there would be some voluntary isolation at this point, but no voluntary quarantine yet.
Any other questions?
I'm good.
Peter?
I'm good, thank you.
Tim? Well, I'd like to just close by thanking everyone for coming. We'll be around for a few more minutes if there's any other specific questions. And again, thank you. We will provide regular updates for you. Kevin, as our PIO, will get information out. And as we've heard in all of the conference calls, this is a very fluid situation. things change. As we know, within the last hour, the Cold Spring case was confirmed by the CDC, and things change very frequently. And I do know the governor is either going to be on at 10:30 or 10:45 from Cold Spring to address as well. Nita?
Yeah, I want to have the last word. I would like to have everybody know what the MDH hotline is, and we are encouraging people to call that. It is 1-800-657-3903. Again, that MDH hotline is 1-800-657-3903. And so we would be encouraging the public to call that number.
And that's just a general public information hotline?
Yeah, for anybody in the whole state.
Okay.
And it is staffed from 6, I think, and from 8 until 4:30 each day at this time, and those hours could change depending upon what happens.
Question, do they have bilingual help at that?
Yes, they
number as
do.
well?
Spanish particularly, Somalis particularly, yeah, they do.
Well, one last thing, we wouldn't be good nurses and physicians if we didn't demonstrate, make sure you're washing your hands. It sounds kind of trivial, but it really is one of the key ways to keep yourself healthy, individually and for your families. So, thank you.
Thank you.